Good morning, everybody. I'm glad to see you all here. I'm the Managing Director of Germ Kill. I'm here to introduce you to those people who are present today. Some travel from overseas. We have from the University of Minnesota, Dr. Todd Andrew Kellogg, who is the Assistant Professor of Surgery, and he's well known for being involved in surgical infectious diseases. He is in fact going to test the thing in the United States and probably will introduce it there later. Our distributor from Indonesia, Eddie Santoso Satuawan, he's with us today. I have Richard Rees here, who is also acting in the States for us in Castle Construction. He's been involved in some of the hurricane disasters there and the repairs that go on and the need for killing disease. In terms of the supplier, we have Roger Veery, who's the Business Development Director of Soilbind, who are the suppliers from the UK. Our role here in Hong Kong is to take that material and market and bottle it. We have to do certain preparations to do that. Additionally, I'd like to thank Mrs. Doris Lee, the creator of China Limited, for sponsoring bringing the chairs and tables, the chairs and table for demonstration. The reason we got those is they're used in schools and hospitals, and we think these things need to be coated with our material. And lastly, I'd like to welcome Dr. Chuang and Ralph Lee from the Occupational Hygienists of the Infection Control Branch Centre of Health Protection here in Hong Kong. Today you're getting a presentation, and I put the display on the board earlier, first of all from Dr. Brian Walker, and I think on your invitation you had a detailed description of his involvement in Hong Kong, because he's a well-known broadcaster and TV personality in terms of medical things. And on this side I have here Dr. Vic Garner from the UK. He is the designer and starter of this whole thing. He designed the elements we have within the system we're going to market in Hong Kong. So to start the presentation, I'll ask Dr. Brian Walker to take over at the stage and give you a presentation detailing out how this thing works. Just one thing before he gets to it is this is a unique product in many ways, and one of the most unique features is it's one of the only ones that you can actually detect it there and it's killing. We have an ultraviolet system that you can actually see it's still there and working, and I think it's unique in the world. So without ado, I hand over the mic to Dr. Brian Walker, and he can carry on with his presentation.
Thank you, Dennis, and good morning, ladies and gentlemen, or good afternoon now. Microbium, an essential tool. Don't worry, I'm not going to read from the slides that are coming. I think that's the best way of putting you to sleep. But I do think I want to tell you why I'm excited. It's soap, disinfectant. Why should I be excited? Well, on three levels. One, I'm a father. I want to keep my family safe. Two, I'm a doctor. It's an interesting, very interesting situation, and you'll hear about the technology later. And thirdly, I'm a business owner. I have a clinic in Hong Kong, and this is definitely going to help improve my business, simply from a marketing point of view, but also the safety of my client. I beg the pardon of my colleagues in the medical field, because I'm going to go through a short and I hope accurate overview of what infection control is all about. But you know that the first mention of infection control is actually in the Bible, as far as I know, many thousands of years ago. And in Leviticus, we're very, very clearly hear how to look after ourselves in the event of infection. a pandemic, an epidemic, and it's the old principles that Moses gave us are still valid today. And this isn't always clear to people who are not in that technical field. So what are the main issues we're actually confronting just now? It's an ancient situation, but after all these thousands of years, what do we have now that is going to be different? The first thing we've got to recognise in infection control is that panic is the almost universal response. Who here does not remember SARS, when people were leaving in droves, off to Canada, going away as far as possible? And of course, when they arrived in the foreign countries, they weren't allowed in because they possibly had SARS. Businesses collapsed because of poor cash flow. The economy went down, the stock market fell, it was awful. Everyone was wearing masks, but we all know that masks are a very, very ineffective viral filter. And so there we were, confronted with recommendations to take action which was actually inappropriate. My favourite is actually on the escalator, seeing a gentleman wearing a mask with a hole cut in it and a cigarette dangling from his lips. A really ineffective way of using the mask. Going on from that, of course, I'm not going to read this slide at all, but the main issue here is to deal with uncertainty. I mean, we've had H5N1 rammed down our throats for the last, how many months now? A year, in fact. And we get blasé about it. It's unimportant now. The same thing with MRSA and tuberculosis. Who cares about that now? So the whole, and when is it going to come? Is it going to come? The uncertainty leads us now to inertia. We're not going to do anything until it happens, and it's going to be all right then. So we're actually led to believe that with this uncertainty, we're not going to take action appropriately as ever. When it does hit us, whatever hits us is going to be unexpected. We're going to have panic, we're going to have confusion, and that's an almost universal experience. The idea of control. In the good old-fashioned days before I was born, control was quite simple. You travelled by ship. When you got to port, you went to Port Health, and we still have Port Health in Hong Kong. And if you had any problems at all, you were quarantined 3 weeks in the ship, and no one was allowed on, and no one was allowed off. And if no one died, there's no disease, then you could actually enter the town. And that is still what we try and do today. We all remember what happened when the airplanes were stopped and we were all searched and checked for fever. And not really that effective. I mean, a 30-minute delay is unacceptable now, as against a 3-week stuck on ship in port. It's not going to happen anymore. And so the control is a little bit more difficult nowadays. But today we're going to see what we can do in the way of looking after ourselves. There's several areas. The government, of course, has got a major role to play here. The institutions have an even more important role, because the government may not always take action appropriately. The idea is, if the government takes action, who is responsible? Is my backside covered? Let's wait and see. Whereas the institutions, the businesses say, well, listen, if things are going to cause our business to go down, I am responsible, let's take action now, let's not wait, let's do it. And so business is far more energetic. And of course, the individuals, us, me, in my family, what action can I take to keep my family safe? This is what we're looking at. Here, of course, the management primarily is going to be the medical technical side, your control of infectious disease. But also, if you're a business professional, and in a large business you would certainly have this, I would expect you've already got contingency planning in place. How can I protect my business in the unlikely event of something nasty happening? And the same thing is true for the individual as well. So going on from that, of course, if you don't have management in place, the result is going to be panic. And even if you do have good management in place, part of that has to be, how do I control panic? And a lot of what we're going to be talking about is how do you actually control hygiene and reduce panic by increasing the security of the employees, of the population, of staff. Panic was understandable. At the moment, if you had H5N1, you know the death rate is 60%. 6 out of 10 die with H5N1. And if we assume that it comes through, that 25% of the population catch it, in Hong Kong it's 1 million deaths. And at the height, it is a bell distribution curve. This would mean, at times, 120,000 deaths a day at the peak of the infection. Who would not panic at that? I would. Thankfully, it's not nearly going to be as bad as that. Let's assume, at the very, very best, only 10% of us catch it. And let's assume the mortality is reasonable at 0.25%. That is still just under 2,000 deaths in Hong Kong. Now, which father would actually let his children take that risk? I don't think many of us would. So panic is a natural precursor or successor for infection. So modes of transmission. There are actually only two modes of transmission, direct and indirect. Direct you won't bother about. That's HIV or hepatitis B, modify a lifestyle and you're sorted. The indirect, now let's describe this. Let's imagine for one moment you go to the toilet and you wash your hands, as I hope we all do after going to the toilet. So then you put your hands on the tap, you see, get the water going, get the soap, wash your hands, then you put your hands back on the tap to switch it off, and now you've got nice bugs on your hand again. You dry these nicely, and off you go and touch your bugs onto the door handle on the way out, exchanging your bugs with the ones everyone else has left behind. So the idea of washing your hands after going to the toilet, excellent though it is, and as we must do, does not mean you have clean hands when you come out. This is indirect transmission of disease. By the vehicle is going to be through door handles, doctors, receptionist desks, HSBC counter, the handles of the MTR, shaking hands with your friend when you see them. These are all methods of the direct contamination. So the general principles, going on from that, I'm not going to talk about this, but imagine if you followed general principles and you had a business of 3,000 employees, would your strategy make a big difference in the wellness of your company? Absolutely right it would. Let's talk about that. But to do that, we've got to look at the sources of transmission. What's the enemy? What are we going to be attacking here? And some of them, as you can see from the slides here, are out with our control. Next slide. Next slide. Because separation from the source, the quarantine, that's a government thing to do. The state of your immune system is hugely important. TB isn't just a problem of bacteria, it's population control. If you're crowded, if you're in poverty, if you're malnourished, poor immune system, that's the real problem. And that's not something that we can take care of individually or as business, or it's more likely a government thing. Some areas also are far more likely to cause you a problem. You notice here places to avoid. This isn't to make you frightened, it's to give you a sense of a focus. Where can we apply these general principles to maximum effect? Hospitals is a really great place to catch an infection. If you want to get sick, go to a hospital. Now, or a doctor's waiting room for that matter. The amount of bugs you can catch there, I'm exaggerating just a tad, because one of the biggest problems we face in the medical profession is how do you stop people getting sick if they go for an operation or are lying in hospital with weakened immune systems in a poor state of health next to someone who's got an infectious disease, say nasty bacteria growing in a wound. The same thing is also true where public congregates, anywhere where you get people coming together. Think of the IRS, think of a government building when you go to register something, the post office, and indeed any large business. I mentioned HSBC counters, that's true of any bank where people go and lean their hands. And what about public transport? I mean, one of the biggest issues we have, of course, is sitting next to someone in, say, the MTR who's diligently picking his nose, or has been doing something dirty and puts his hands on the railing where you now put your hand. Any place where people are sitting close together, airplanes as example, is a good way of catching an infection. So what are the answers then? Well, the answer is quite simple. I mean, if you're not a government, we have got to break the chain of transmission. This is a job and duty of all of us. Yes, we can immunise, that's a doctor's job, and also a government organisation. But we can't really assure the clean water and food, that's again government. We can't look after quarantine, that's government. We can't eliminate animal reservoirs, and there's no way my cats are going to be killed just now. So the answer really is my individual responsibility as an individual and as a business owner lies in the level of hygiene. There we can make a difference. That makes a big difference. Now I have to say before we carry on, Hong Kong is probably the best place in the world if there was to be a pandemic now, or an epidemic. Hong Kong has a really great organisation and a lot has been done. We've learned a lot from the past. In fact, we're far safer here than we are, say, in America, I would think, because of the close-knit control of infection. A lot has been done. But there are some issues, of course, which increase panic. There's no immunisation available for some of the diseases. And we've got a rising tide of infectious disease. MRSA is a big one. You don't hear much. It's not sexy enough. It doesn't cause 100,000 deaths a day, but it is a major problem for the healthcare professionals. TB is rising, especially in conjunction with HIV, and it's also multi-drug resistant, a nasty form of TB. And other emerging diseases. SARS isn't the only one we've got, I'm sad to say. And these are enough to make anyone upset. So, the issues are, of course, that panic is likely to happen, and hygiene is also therefore uncertain. If you're in panic, how can we possibly think straight? How can we possibly take those measures which are useful? Well, we've got a few solutions for you. Let's focus on the areas for action. Government, not our business. Business and personal. It comes down to what strategy. We're talking about a tool we can give you today, but you can use a tool in a wrong way too. It's knowing which tools to use when, under what circumstances. Let's talk about a strategy that's going to manage a potential problem in advance, so we're not going to panic about it. We've got all the information we need. Now let's use it properly. And that strategy really has to be focused at our level at blocking the vehicle-mediated transmission. This is where we're actually going to focus. Everything else really can be talked about, but isn't in our province as such. We're talking about hygiene, hands. We mentioned a whole host of things earlier. How much impact can we have if we were to control this particular aspect? How much impact would it have on a community if we knew that in the event of nasty things happening, you would be safe in your bedroom, in your house, in the lobby of your building, in the public transport, and in your workplace? How much more confident would we be in maintaining all the services if we were being cared for appropriately? And what's the excitement here? Well, let's imagine the ideal solution for blocking vehicle-mediated transmission. It would be 100% effective. It would kill everything. It would kill bacteria, it would kill viruses, it would kill fungi, and I don't have to worry about anything at all. I could put it anywhere I wanted and it would do the job. It would be long-lasting. I would have to apply it once and not bother about it too much because, hey, we've got other things to do. If my children were to drink it out of fun, they would not be killed. My pets licking it from the floor would not be suffering. I could use it easily. It's not difficult to use. And also, if I do use it, it's not going to bankrupt me. It's not going to be so expensive that I can't afford to use what is a perfectly good tool. Well, the good news is that Microbiam does in fact represent that. Okay, it doesn't give 100% protection. 99.9% is very, very good. It's as close to 100% as I've ever seen in my clinical career, and that is almost 30 years now. Very, very good. It's simple to use. If you can use Dettol, you can use Microbiam. What's new though, and we'll hear about this later, what is new about this substance? Well, it lasts for a long time. You apply it for at least a month later, it's going to be killing 99.9% of all your organisms. We had one result, 99.8%, but, give and take a little bit. Very, very good results. Toxic? Well, not really. If you lick it off the ground, it's not going to affect you. Children swallow a mouthful, it's not going to taste nice, but they won't swallow anymore, and it won't kill them. It can be used on a variety of surfaces. We'll hear more about that later, just how that can be done. So you can, for example, if you're working in intensive care, you can apply this to the face mask, the eye mask. Now, let's imagine you're on a respirator, or should we say you're severely ill in hospital with, say, a flu-like illness, and you cough, cough, cough. Now, of course, we're wearing a mask, certainly, but the transmission is actually through the eyes, primarily. So you have an eye covering now. So someone's coughing and it lands on your eye mask. Grand. At the end of your shift, tired, you now take your eye mask off, you think, oh, that was a hard day. Of course, you've now got H5N1 or whatever on your hands, and it's now in your eyes, and that's not going to do you any good at all. Coat that with Microbiam, and you can touch it as much as you like. There will be no bacteria or viruses on that surface. The same is true of all your protective clothing and your mask. No matter what is being thrown at you, it's going to be safe. Incidentally, for disaster relief, you can spray this probably on the rubble of an earthquake disaster area and effectively manage the outbreaks of disease like that. So what a variety of approaches, from the eye covering of intensive care down to mass rubble of the disaster area. And here we can begin to see some of the applications. If you want to frighten yourself, get a degree in microbiology, take a swab from the operating theatre or intensive care air conditioning vents and compare that with the swab you take from under your car in the car park. You will find a lot more nasty bugs, multi-drug resistant bugs in the operating theatre than you will ever find under your car in the parking lot. Now, you have a weak patient with an open wound being exposed to these nasty bugs. This is one reason why we get infections perioperatively, and one vastly important area for managing if problems should occur. But also in the ordinary wards, you're lying next to Mr. Chan who's coughing TB bacteria out, and it's nice to know that when they land on the surface next to you, they get killed as they land. Government buildings also very important. I mean, if you're looking here at your ordinary IRS building and you're going to pay your tax, it's nice to know you're not going to actually get something back in return, something like someone else's germs. The same is true of all areas. Next slide, please. You could use it for border crossings, for example. How about Chetlakok Airport, where it would sit from the time you enter the airport, and it's working to kill germs that are being shed from the passengers right through the airport and right to the baggage reclaim and the meeting area. What about if the airlines were to use this on their planes? So you get on the plane into an atmosphere which is killing germs. I've certainly been on plenty of planes where when you land, they come and they spray the area to make sure you're kind of chemically quarantined. Doesn't do a great deal of good, but you feel good about it. You kill the germs. Nonsense. Put this in the air conditioning vents, the air intake of the jets. Put it on the chairs, on the floor, on the utensils you're taking. And you know how it is? You catch a plane, you see, and someone's got a cold next to you, and it feels it, and you catch a cold as well. Well, we can reduce that risk of infection by cutting the ability of these pathogens to sit on the surface and wait for you. I mentioned the public services there, of course. We've just seen the NTR with this nice titanium oxide covering, which can be toxic, difficult to apply, and expensive. But apply microbium onto all the surfaces there, the floor, the walls, the handrails, everything there, and you can have people coughing and depositing the bits of the nose on the handrails, and you know the bacteria there are going to be killed. It's nice to say, you're not going to grab it immediately, of course, maybe wipe it a bit, but it's going to kill the remaining germs there. So you can greatly reduce the risks of transmission of infection. And of course the same is true of schools and kindergartens. The norovirus outbreaks recently, which have closed a couple of schools and kindergartens, but children are notorious. You know, they lick each other, they lick their toys. But the same can also be said of casinos, when you're kind of kissing your chips for luck. You know, and what about in the hotels, in the restaurants of the hotels, where you're sharing implements and not always hygienically. So, and then we come, of course, to the homes. There's something so simple as this can be applied in your toilet, in your dining room, in your bedroom, anywhere where there's going to be a surface exposed. You can have a very, very clean home environment. So, now this sounds like it's the God's gift to mankind. No. We're talking here about a tool. We're talking here about one area of transmission and one tool, which is a vast improvement on what we've had before. It will not, if we were to have a catastrophe happening, say massive deaths from H5N1 across the border and coming into Hong Kong, it would not stop the pandemic. It would, however, be a remarkable tool for reducing the risk of infection in the population and adding one tool to our armamentarium, to our strategy for managing outbreak of disease and reducing mortality, people who die, reducing morbidity, people who get sick, and reducing panic in the population, or a population secure in the knowledge that everything has been done and as far as possible hygiene has been maintained. And that in a population which is not particularly trained to practice hygiene. You don't have to depend on people learning how to clean their hands or use face masks. You apply this, you leave it, and it is done, and you can be as dirty as you like. What you leave behind will be killed. So it is very useful for public health measures. And that's what we're dealing with. So on the last slide now, back to the ancient battle. It is an ancient battle. It's nothing special. We've had this for forever and ever, but now we've got one more tool, as I said, which I'm sure Moses would have greatly appreciated in management of leprosy outbreaks. We have it now, and there's so many ways of applying it, and we'll hear how it can be used to maximum effect and why it works in a short while, and I hope I haven't bored you too much.
Given me the starting point of my talk. And can I also thank Mr. Poole for the invitation to come here and talk to you. And this is very dangerous because I'm a career chemist. I'm perhaps a fanatic for chemistry, and I've got a captive audience, and I'm going to talk some chemistry to you. So I'll give you my apologies right at the start. But this phrase that I've got on the screen, cleanliness is next to godliness. This is what we've got to do. Before these organisms get into the living system, we've got to stop them. If you can stop them on the hard surface, you can use all sorts of chemicals. Once they're in the system, it then becomes extremely difficult in order to kill those organisms. And this phrase, cleanliness is next to godliness, it's a phrase that is lost in the antiquity of time. It's when you look at all the major religions of this of our society, there's a hand washing or foot washing. There's some sort of washing that goes on, and that was just with water. We've now got a whole series of materials that we can use to improve that cleanliness. And on this next slide, this story is now coming out from the major drug companies. This is from quite a recent report, Bugs and Drugs, Antimicrobial Reference, the Capital Health Group, who are saying that the best way to stop infections is wash your hands. Not only wash your hands, wash the surfaces. So you would spend all your days washing your hands, washing the surfaces. Is there something better? Well, I think there is, and it's microbiome. So on the next slide, okay, there's the main title. I want to give you the scientific background of what microbiome is, how it was developed, how it works. If you understand the mechanisms of these things, well, then you've got a better idea of making an effective product. So in order to do that, the next situation is that we've got to look at some material chemistry. I did warn you, you're going to get some chemistry. Well, let's keep it fairly simple. And by the material chemistry that we want to talk about, I'm afraid, sorry, it's one of these automatic things. I do apologise. Right. If you go right the way back to the start, we've got the fundamental particles, the atoms, which are composed of neutrons, protons, and electrons, and those are built up so we get different elements, and the elements combine to produce molecules. The molecules interact, and it's that interaction that is the starting point for our consideration. If you get a donation of electrons, you produce polar ionic species. If you share electrons, you get no charge transfer, you get non-polar species. And on the next slide, this is the division in chemistry that we suffer from its introduction, 3 centuries ago. We have inorganic chemists and we have organic chemists. Inorganic chemists look at inorganic molecules, inorganic compounds. These are electrovariant. Think of common salt, think of mineral acids. Those are inorganic materials. Organic materials, covalent, non-polar, sugar, oil, fats, different sorts of materials entirely. But there's another group of compounds, the amphoteric compounds. They've got characteristics of both. And it's those materials which are quite fascinating. They sit at the interface, at the surface. That's why we call them surfactants. And here's a very simple model of a surfactant. This is common soap. So you have a very long alkyl chain, which is non-polar, it's hydrophobic, it hates water. Whereas this side is polar, it's hydrophilic, it loves water. You've got inorganic characteristics and organic characteristics within the same molecule. So the amphoteric compounds were our starting point, soaps. On the next slide, we've got a different sort of material. Instead of having an anionic system, we've still got a polar material. You see the charged separation. We've got positive charge on the nitrogen atom, negative charge on the chlorine. But this is a type of ammonium salt. Ammonium because we've got positively charged nitrogen. There are 4 groups attached to the nitrogen instead of hydrogens as we would have in, say, ammonium chloride. We now have 2 methyl groups, which are represented by these 2 bars. Usually speaking, there's a couple of methyls in this sort of compound, and then we have 2 other alkyl groups. One could be methyl, so you'd have a trimethyl system. The other group is a very long chain group. By very long chain, anything from 8 carbons to 28 carbons. It could be a benzyl group or an alkyl benzyl. The main thing is that we have this quaternary system, 4 bonds around an ammonium ion or a central positively charged nitrogen, hence quaternary ammonium compounds. That's the basis of our material. On the next slide, we've got a model of a typical quaternary ammonium compound. 2 long alkyl chains running up and down. There's the nitrogen atom. That's the central point where the positive charge is, and we've got the 2 methyl groups, one behind, one in front. That is a typical quaternary ammonium compound. It's abbreviated to DDAC for didecyl dimethyl ammonium chloride. On the next slide, let's just compare these particular materials. They make pretty good biocides, pretty good detergents. The QACs, like didecyl dimethyl ammonium chloride, it's got a good pH range compared to phenolics or iodine-containing materials or hydrochloride. The pH range is restricted. They're good at cleaning. The others are not so good because QACs have got a surfactant property. They work at surfaces. They tend not to stain compared to iodine, for example, and phenolics and hydrochloride. You don't get the material incorporated into your skin, dental penetration, or onto your clothes quite as badly. They're good from the commercial point of view because they've got good storage properties. Whereas bleach, you'll find if you keep it for a while, it deteriorates. The chlorine gas is released. And the disinfection, sanitisation, and I'll explain these terms a bit later, not too bad. Okay, not quite as good, but if you've got time on your side, you don't need to have a very, very powerful material that will kill the bugs, as long as you've got something that will do it given enough time. So on the next slide, we have some more data. Minimum inhibitory concentration, that means how much material do you have to put in there to inhibit the growth of an organism. And these are data for this DDAC, you see the dialkyl dimethyl ammonium chloride written up there. So in the left-hand column, we've got various bacteria. Central column, we've got algae, and in the end column, we've got fungi. This one down here is quite interesting. This is the black mould that you see in all bathrooms. With microbium, you can stop that black mould growing, put it on there, and 6 months later, it's still absolutely clean. So if you've got nice white tiles, you don't want black mould on it. If you've got black tiles, great, let the mould grow. But what we've done is, particularly to target this material, the Pseudomonas aeruginosa has the worst set of data in all this lot. But that's the organism that we're using to test against. We're deliberately meeting this head on. And this particular organism occurs in a lot of water. It often comes in on town water, certainly in the UK. And I've analysed quite a few samples of detergents, the washing up liquid, which actually contains Pseudomonas aeruginosa, actually in the detergent. It thrives on detergents. But in the case of quaternaries, we're not too bad. We can knock that out. On the next slide. Here we're comparing our standard quaternary alkyl methyl ammonium chlorides with microbium. This is the active material in microbium. You can see we've got the long alkyl chain, and then we've got another group sitting around here which is equally non-polar. So it behaves like the second chain. We have the central nitrogen atom with the cationic charge, and I often refer to this as a cyclot system because contains quaternary and silicone moieties. On the next slide, we've got the true structure of the active principle of microbium. Here's our cationic beast. Here's the long alkyl chain. Then here's the other chain that's along here. It is registered with the EU as a biocide. It's also logged with the American Environmental Protection Agency. On the next slide, what I've done here is to emphasize the two parts to this molecule. The important parts are the quaternary, which is, if you like, the killing parts of the molecule. That's the bit where all the action takes place with the microorganisms. This bit, this is the trimethoxysilyl part. This is what I call, or refer to as the anchor. And this is the major difference between microbium and all these other quaternaries. The microbium has the same sort of activity as other quaternaries, but it has an anchor. And it's that anchor that fixes it to the substrate, to the surface. On the next slide, this is a fairly complex slide. There's an awful lot of information on here, but what I've tried to do is to generalize things by saying all surfaces have some sort of function, usually a hydroxyl function, whether it's a metal with a hydrated oxide, or whether it's a plastic which has become oxidized, or whether it's a silicate, a ceramic, which has naturally got hydroxy groups sticking out from it. There are functional groups sticking out from any material. The microbial molecule has this reactive anchor which interacts with that oxygen function, so that we then get a full chemical bond, not just a charge transfer system, not just a positive and minus linking together. We've now got a full chemical attachment onto that surface. And you're going to get multiple attachments together. So you're going to get a whole series of these microbial molecules tagged onto the substrate surface. You then get another interaction taking place between adjacent molecules. So you develop a silicone polymer, which is represented by this structure here, with one on either side. So you produce the silicone polymer over the surface of the substrate with these quaternary groups sticking out. And it's the quaternary groups that do the damage on the microbes, whereas the silicone polymer, of course, is protecting the surface of the substrate. On the next slide, here's our structure. Perhaps you can see this a little bit more clearly. Bound to the substrate through a full silicon-oxygen bond, which is a very, very stable bond. The silicon-oxygen bonds are, of course, so stable that sand contains silicon-oxygen bonds. It lasts for a long time, so it's difficult to break those. And here's our silicone link running over on each side. On the next slide. We've tested this. It's been tested time and time again in a lot of countries, and including Hong Kong and UK. We've used standard protocols. Most of the protocols that are used, in fact, with microbiological testing, take place for a very short time. It may be 1 minute or 3 minute contact. In all these cases, because the microbiome is bound to a surface, it's that that's been tested, and a 24-hour contact time is used. A whole range of organisms has been tested against. I'm particularly interested in the Thiobacillus organisms, because we've been talking about medical conditions, whereas this means that you can actually utilise it in an engineering environment, because Thiobacillus, the sulfate-reducing organisms, are very, very important in metal degradation, in corrosion, for example. So oil pipelines works on those as well. Substrates, we can use natural fibres, substrates, or synthetic fibre. We can use metals, we can use concrete. And I've got some samples of concrete that was made up just over a year ago, and they are still not showing any bacterial degradation. There's no algal growth on those whatsoever. On this next slide, the results of all these tests. Log reduction factors, in other words, the extent of sanitisation. at least 10 to the 4, frequently greater, but the important thing is 28 days after treatment. And in fact, some of the data that's come through from the Hong Kong laboratories and the Hong Kong tests show that that 28 can be increased by a considerable amount. Many, many days, many, many weeks. And that's the terrific thing about Microbiam. In some instances where there was a frequent washing, the rate of activity, the efficacy rate was reduced, but only very, very slightly. So biological evaluation, yes, it shows that the material is bound there and bound for a long time. Why? How does it work? Well, any cell, we've got to consider all cells. When you look at this is a Microsoft idea of what a cell looks like, every cell is composed of membranes. We've got outer membranes, plasma membranes, cell walls. We've got membranes within the organelles and around nuclei. Every cell requires membranes. If it wasn't for the membranes, we'd all be in buckets. Something is needed to keep all the chemicals together. On the next slide, I think we've got a picture of the, again, taken from the internet, of what a typical membrane looks like in a cross-section. You've got polar heads and non-polar tails. And this is a situation that we've seen already this morning, polar heads and non-polar tails. In other words, these things have a very similar structure to the dialkyl cationics that we're looking at. The only difference is that these are anionics, they have a negative charge. So when we start introducing our cationics into this situation, remember, when you have any of these non-polar polar molecules, they will adopt a particular orientation, and our membrane is in fact one particular example of a thing that we call a micelle, where all these ionic heads have lined up with the non-polar tails sticking together. So that's what would happen in water. If you put it into oil, you would find that the tails would stick out, and you get all the ionic heads together and the tails sticking out. So in other words, you could use this to deliver materials through a lipid membrane, for example. This is how some of the newer drug delivery systems are working. So our membrane around the cell is simply a micelle. What we find is that this membrane is perturbed, it's damaged in some way. The membrane, like the micelle, is charged. The charged nitrogen of the quaternary associates with a negatively charged membrane species, the phospholipid. But not only have you got the sort of the octopus body sitting on there, all its limbs are spreading out, and those limbs are hydrophobic. The tails interact, and you start producing micelles incorporating the microbe cell itself. And what happens there is that you start to get a leakage. Small to start with, but all that leakage immediately causes a loss of cytoplasmic material, and you start getting cell death. Pretty low levels, you get stasis. In other words, the organisms stop to grow and get the concentration a little bit higher, and you start to kill them, including quite a lot of the viruses, especially the lipid envelope viruses. The important thing to bear in mind is that it depends upon how much antiseptic you have there, the concentration. It depends upon what the bacterial cell count is, the density of cells. But crucially, it also depends upon the time of contact. So even with a fairly short contact time, you're still beginning to get this leakage. Once you've got the leakage, you then start to disrupt biochemical functions. On this next slide, let's just go through the levels of what this leads to. If you get only a small effect, the material could be called a sanitizer. These are the EPA definitions of what things are. So in other words, it significantly reduces. It doesn't necessarily kill everything. A disinfectant you will target a particular species and it kills most of them, but not necessarily the spores, in other words, the protected bits that pass things on. The sterilant is where everything is knocked out totally. An alternative way of looking at these materials on this slide, the guys that I used to work with came up with these definitions. Disinfectants are where you would require a very, very high presence of material because of the amount of soil or dirt and a high population of bacteria. Biocides are to prevent degradation, really. Antiseptics are mainly to prevent infection, and particularly on body surfaces. Whereas sterilisation or sterilants, that's where you would have an enclosed space and you would kill everything that's in there. So you don't need people to be in there because you're using such toxic chemicals. But we're trying to move away from that with our microbium. And say our particular material is this species, this silicone quaternary system, and we suggest that this material behaves as a biocide in exactly the same way as a quaternary ammonium compound. It shows certain disinfection characteristics and certain sanitizing characteristics depending upon what the bacterial cell content really is, how many bacteria are there. But let me just tell you a little bit about some other work that I did quite recently, and in fact is being repeated at the moment by the EU concerning water and water pipelines. At one time everything was pumped through lead pipes, and then you found that lead was being introduced into the water supply, and in fact the highest levels of lead that we ever found when we were analysing drinking water supplies in the UK, the highest level of lead was in the Houses of Parliament. Now that does perhaps say something because it does affect brains. So you went away from lead pipes to copper pipes, and then they found that copper was not perhaps the material that you should use, and an attempt was made to introduce polythene, but polythene didn't make a very good pipe. You needed a cross-linked polythene, so hence PEX, and the European Union is currently investigating PEX and its use as water pipeline. And how this is done, again, I apologise in advance for the chemistry, but you start off with ordinary polythene that is synthesised in just the same way as you produce polythene for polythene bags or polythene buckets, and you introduce a reactive silicone system into it. So you tag or you graft this group onto the polythene molecule. On the next slide, it shows what happens when two of those come together, and you have this bridging group which cross-links one polythene chain with another. That produces PEX, or cross-linked polythene. That's the material that's used in the drinking water pipe. And we had to prove that that group linking those two chains, which is very, very similar to the sort of group that we've got in Microbiam, we had to prove that that did not come off there. If it came off and went into the water, PEX would not be allowed to be used for drinking water pipelines. On the next slide, there's a little bit of data. The pipes were investigated by the National Sanitary Foundation in the US and the Water Research Council in the UK. And the leaching test that was applied lasted for 90 days. So in other words, the polythene pipe made with a cross-linked polythene was extracted for a 90-day period, and then every component that was extracted had to be identified. The technology we were using was gas chromatography, mass spectrometry, and in some cases the levels of material extracted were down at the parts per quadrillion. 1 part in million. Fantastically small amounts. And on this slide, so we used this technology, we were able to identify every one of these. In not a single case did we find the silyl cross-linking system that's used in Microbiam. We did not find that in any of the water that was analysed. We found lots of other materials, but those materials came from the antioxidants that were in the polythene. And on the final slide, here is one of these materials, 2,4-ditertiary-butyl-phenol. It was a material that is used very commonly in plastics manufacturing, particularly in polythene. and this material has been identified in every study. The amount that was identified in an old plastic pipe from Denmark, from Aarhus in Denmark, had about 2 micrograms per litre, 2 parts per billion in that. Groundwater was only just above 1 part per billion. And it was interesting that a cup of tea bought in a cafe in Aarhus had 10 times that amount of material. But nowhere did we find that silyl group breaking down. And that is the key difference between microbium and all these other materials that are available to keep us next to godliness, for cleanliness. Microbium contains the silyl group, which anchors the biocide, the sanitizer, the disinfectant, doesn't matter what you call it, it anchors that to the surface. The surface can be almost anything, from ceramic to metal to plastic to wood to fabric. And provided you keep it on there, it's going to go on killing microbes, but not our children or our environment. Thank you very much for listening to me.
Ladies and gentlemen, thanks for listening, and I just want to introduce finally the Press Free group, who probably met a number of you. We have Lee Kin Tak, who is the director of that group. He's going to, for us, demonstrate during the rest of your time here how this material is used. There are the main substances used. We have a deep clean. The idea of the deep clean is to prepare the surface so the linking of microbium into the surface can be maximized in terms of effectiveness. The super seal is actually the microbium substance which then goes on the surface, and it can only needs to be about 10 microns thick. A very thin layer. You'll see some gloves which we've designed. You can wipe it onto any surface, and once it's on there, we have proved a minimum of 30 days killing property. There is another substance we offer, is a daily clean. The daily clean is merely to wipe off the dead bugs that accumulate over the microbium, because obviously if it kills a lot of bugs, they're going to block the effectiveness of that bug killing ability. And we offer the daily clean as part of the package. We have a box there which is 50 square meter application box, which we designed for particularly our doctor friend here. He wants to use it immediately in his surgery, and he's going to persuade a number of his doctor friends to do exactly the same thing, where you can apply it on any surface in the surgery, and as he said, on some of the masks or whatever they use. And so we're offering that for people who want to trial through Press 3, and you can approach these guys and buy that box to start you off if you want to try it out yourselves. In that box we do supply the UV sensor. It's a small bottle, you can just apply a spot, and they can demonstrate to you that with an ultraviolet lamp you can see it's there. If that disappears, you know it's not there. I mean, this UV sensor is specifically designed to link in with the microbium, so that if the microbium is still on the surface, you'll see it. And as I said at the beginning of the presentation, this is a unique feature in the world where you can actually detect that the thing is still working. I don't think you know another disinfectant or any other form of germ-killing agent where you can actually tell it's still killing. So I will hand over to our friends from Press 3, and they can take it from here.
咁啊，即係而家我哋講一講解就係我哋點樣去做呢一個嘅microbial 嘅保護膜。咁其實基本上嚟講咧，我哋就分開3個程序嘅。咁第一個程序就係我哋基本上仲要用一啲簡單嘅清潔劑、清潔水咧，即係清水咧，就洗咗個保護膜就可以 OK 嘅。咁啊，等佢乾咗，稍為乾咗之後咧，咁我哋就會再加我哋第一隻嘅 product 叫 Deep Clean。咁 Deep Clean 最主要嚟講嘅作用咧，就係話將嗰個表面入邊嗰個 地方咧就將佢清潔一次，咁然之後咧我哋就會係再加另外一隻叫 Super Seal A。咁 Super Seal A 最主要嚟講咧，都係會係做翻一個防菌嘅工序喺度嘅嚇。咁而家你睇到咧，基本上就我哋已經可以係即係我哋做咗嘅。咁其實即係我哋啱啱德咧就已經做咗一個 dating 就喺呢一張嘅台嘅表面嚇。咁而家我哋就等佢乾。咁其實個需要嘅時間都好短，我諗大概1-2分鐘到嘅時間咧就可以安排到嘅。OK， 咁而家我哋可以再用另外一個方法，就係話我哋 apply 翻一個 Super Seal A 嘅防菌膜喺個表層度啦。咁最主要嚟講，我哋可以用幾個唔同嘅方法去做啦，就係用一個好似 spray 咁嘅形式，就將佢噴咗落去。然之後我哋就再用一塊嘅布，就將佢均勻地咁樣就將佢抹咗喺嗰個表面嗰度嚇。咁其實都係需要等一個時間等佢乾啦。咁其實最主要嘅時間嚟講，我諗就要睇翻本身佢個表面上嘅物件嚇，咁嘅吸收嘅情況而定嘅。咁一般嚟講，如果係一啲膠嘅物件嚟講咧嘅時間性就需要好快嘅啫。咁我諗大概會係要邊喺2-3分鐘入邊咧，就都可以會乾咗。第一次去做嗰段時間嚟講咧，我哋就需要係做2浸嘅 Super Seal A 落去嘅。咁其實呢個就確保翻本身嚟講嗰個物件嗰個 Super Seal A 係能夠可以好緊密地咁去黐住咗喺個表面嗰度。好啊，咁而家我哋暫時嚟講咧，就需要一啲時間俾佢哋去乾啦。咁我哋而家咧就可以去安排我哋一個嘅自助嘅午餐先。咁一陣我哋就轉頭，我哋翻嚟咧就可以再睇一睇，究竟我哋做咗呢個表層之外，係有乜嘢分別同一啲另外嘅物件係未做嘅。咁我哋可以用一啲嘅顯影劑就可以係好明確咁樣俾你哋睇到，基本上做咗嗰個防菌膜同未做防菌膜嘅分別究竟喺邊一度嘅。
I know that was in Chinese, there's those English speaking here, but basically what was said is we apply it by putting the deep clean, and the microbian has to dry, the Super Seal. Once it's dry, which takes a little while because it's water-based, it's ready for use. As you see, they put it on a tabletop. We've got chairs examples. We've also got some tiles there we put it on, and to show the UV sensor how it works. And during the rest of the afternoon we're here, you can come and have a look and discuss with individuals here. There's Ian there from SES, who's the distributor in Hong Kong of the product to us, and representatives in Hong Kong who can run through it with you. We have being laid on now lunch. There is drinks, whatever you want to drink, wine, spirits or whatever is available from the waiters there, and please enjoy your afternoon, and any questions do come and ask us. Thank you. Those of you who wish to send representatives along, we have another session on Wednesday afternoon in the City Garden. We'll put a slide up to showing the venue, and that starts at 4 p.m. We will have people available there to answer your technical questions and do a brief presentation on the subject again. We know you may have colleagues you want to send along. Please don't hesitate to do so. We have enough seats in the venue to do that. Thank you.
They just roll off your tongue so easily.
It's just that when people start getting them from walking out.
It's about to bust like a nuclear.
There's no glow. But if I take it away, you can't tell. So everything. Highlight. That is not detrimental to the effect. The microbium right at this point where the glow is still the same effect as without it. So in actual reality,
And we try and pull all sorts of areas.
this is my fun time. Really not much difference. It's only 10 microseconds. One, see the glow. Right. If you come to this one, obviously there's no glow. So that's the one that's naked. Here. Now, with this, when you take it out, you can see
Daily, on the just a week to touch this area. Every time anybody goes in, it's only because if the germs get on there, they tend to block. It
we're thinking of doing actually. Could you show us right here? One of the problems, everybody keeps well, we want to test it circulate some of the members here without fail. The press that they have been diverted to this segment. So this one, nothing.
Swahili. No, this is that monitor.
No. What have you written G-Kill in?
Yeah, well, in the monitor.
In the product.
No,
Yes,
no.
in the product. Yes.
What we have is.
Thank you.
Okay, this is protected.
Right.
With the antimicrobial protection. So by putting the monitor on.
So that's the only bit that's protected.
No, the whole thing.
So what is
Then I just go yes. If it shows up, like you just down here, then the answer is it's all protected.
Time is running out now. We have previously sprayed the child's school table there with deep clean prior to lunch, and after it dried off, we then sprayed the super seal on there. And if you would like to come up and have a look, what we will do is we'll put the monitor on the surface. We'll allow the monitor to soak in, and then you will be able to see. Now, on the chair, it is the same material. We will also put a drop of monitor onto the surface of the chair. And then we will then be able to, with water, remove the monitor from both surfaces. And we use this UV light that we've developed to show that a surface will have a glow and the chair surface will not have a glow. And that's using this material that we have here. We also have two tiles, which was previously done, one with and one without. I've shown some of you the product on that it glows. We will then put 2 drops on these 2 surfaces as well to show that on tiles it will highlight, and the one that does not have the Microbiam Super Seal will then obviously not highlight. What we're doing now is that will be dropping some drops on these 2 surfaces first. As you would have seen earlier, we have just covered this surface today. These 2 products here we covered 2 weeks ago. I did it myself. So we will be able to demonstrate previously done and what we actually did today. So please. Just a couple of drops randomly anywhere on the surface. What we've done is actually establish that we've covered this whole area with Microbiam Super Seal, and this one has nothing. So from down there you can see it. We've got a liquid on that and a liquid on that, and we will be wiping it down, take the liquid away, and then I will be able to show you that it will glow, I hope. Delay. One area I'd like to say while we're waiting is that the area that you will see glow does not interfere with the activity of the Super Seal killing the microbes. You can see it there, but it doesn't cover it. All it does is show you that it is resident and doing the job of killing the microbes. So we'll give it a few seconds, and if anybody would like to come up, I can start by showing you the 2 pieces of tiles, and I think Mary's seen it already. You can come up and have a look. That could be tiles as well. These lights down a little bit. Thank you. Because now, one of these has, one of these don't have. Okay. So let's go along here. This one is naked. Now, as you will see, that's there, very glowing, because the liquid is the liquid is still there. Now, previously, I've done this one with this as well. Okay, and I even got the name of the company, G-Kill, written like that. That showed me this one has Super Seal A, this one does not have Super Seal A. Now, this one will continue to glow, whereas this one there will be no glow. Allow me just to come back over here. Again, there, just let it down. You'll just wash it off now. Can we have a drum roll? We just wipe it down, and we wipe that one down, and we take a dried piece of cloth, remove the liquid. Okay, showtime. Where's Vic? Okay, here we go. The glow you saw very, very clearly just now is not resident. There is still a little bit of liquid, but the glow is not resident. That one wasn't washed off, yes. This one is washed off, nothing. Now, where was this one? Where did I do this one? Down here? There you go, there's the glow. So, it is there, right? Can you watch the tiles for me, please? So, to be in trouble if there is no glow. And what we do with Daily Clean, you're able then to clean this properly, to remove the dead microbes and allow the surface to contact something else that will come down. And at the moment, 3 months, we have killed MRSA, which is a highly poisonous microbe. And so this little girl is at this point in time, but we will be able to do that. And we've chosen some local cleaning material, and the face mask, obviously, and even simple cotton gauzes, which we have impregnated. And we will show on Wednesday with this and this table, and indeed we will have a plastic surface, which is very important. There's lots of plastics around in Hong Kong. What we're going to do is on Wednesday, 4:30 at the City Garden, we will not only demonstrate that it's there, as we have done here. Where is it? There it is. Yeah. It's still there. The surface is there. But many people will have a question. Is it still killing? Is it still working? We will have another electronic product which we can then verify the amount of bacteria here compared to there. Okay? And by stroking it down, putting it in the chemical, it will tell you just exactly how many bacteria is scared, how many bacteria is there, and how many bacteria is there. So this will show it is working. Some people will say, yeah, it's there, but is it working? On Wednesday, we will show you how, with bacteria count, that it will work. Okay? So if we come back over here now, my last. Okay. Okay, that's where I put it. And now we come down here. This is what I did before. There's the G-kill. And there it is. Very, very clear. I only did that just now. We did that here. There's nothing really. Okay? But here, very, very strong. So this one has Microbium superciliate. This one is naked and doesn't have it. So you can verify when the contractor says, I've done this room. You can go along and say, no, you haven't, because it's not there. Later on, if you're using the mouse a lot, you're going to finish up that. Does it still have? You shine it on, and yes, it's still there. That means it's still working. So up to 2-3 months possibility that it will kill. And this product will take on just about any microvirus or bacteria. Please come on Wednesday. Dr. Vic Gardner will be there. We'll all be there. We'll have more time. It's more casual. Any questions you have, anybody that you would like to invite just to see it, very welcome. Very welcome. We really look forward to seeing you. And tea and coffee, 4:30, City Garden, North Point. Okay? Sorry? 4 o'clock. Yeah, 4 o'clock, ground floor. As you walk in the City Garden, the function room is on your right. Thank you very much for all coming. We appreciate your time, and we look forward to seeing you on Wednesday. Thank you then. Cheers.
咁個儀器就係話翻俾你聽，就係話佢證明嗰個指數嘅 index 有幾多菌喺度，嗰啲菌係生存幾多時，咁嗰部機就會俾你翻嚟。但係而家呢個照咗呢個就呢個普通電筒，唔係嗰個紫外光啦，其實呢個就個儀器就好貴，個儀器個客就冇需要㗎啦。冇需要嘅，我哋做俾你嘅，我哋有需要。我哋再傾。其實咁需要到佢哋私人嘅客戶有。最主要咧係 camera scoring 嗰個基本上係咪都靠住？
the circles, but then you just tell them, and you watch, and you always log on.